So, so much has been covered in this federal election campaign already. We've heard about housing and taxes and a whole lot of other stuff. But one thing it seems we have not heard a lot about is healthcare in this country. Dr. Paul Saba is a Montreal family physician. He's been on with us before, but he wrote an op-ed in the Montreal Gazette the other day pointing this out with some, not just a few, but with many suggestions here on how we can make things better. And Dr. Saba, I appreciate you joining us this afternoon, and I hope some of the politicians out there are paying attention to this. The problems are not new, but you're right. They're not being addressed. I'm not sure if it's fair to ask you why you think they're not being addressed.
I think that the politicians often just kind of follow what the polls are saying. Right now everyone's focused on tariffs, carbon tax. I mean, these are all important issues, but the primary, I always get down to the basis. What's the impact on all this? I mean, if people aren't working, they're going to have poor health. If they can't afford the groceries, they're going to have poor health. So everything comes to me. My focus has always been on health, and that's probably why I chose medicine as a career. And I am very focused right now that we need to deal with the lack of family doctors here in Quebec and in Canada.
Your article, by the way, your op-ed talks about, I know oftentimes we talk about the situation in Quebec as far as family doctors are concerned, how bad that is. It is not unique to Quebec, as you point out in your article, right? This is a problem across the country. But you also have some numbers here. So run down some of what you think we're looking at down the road and why we need to do something about this now.
Well, approximately 6.5 million Canadians don't have a family physician, which means about one in 5 Canadians. And it's important because family doctors are the first point of contact for the population for, diagnosis and treatment of diseases. We're doing screening tests for cancer, for heart disease, for preventive care. And without them, illnesses go undiagnosed, untreated. There's delays, and this leads to often bad outcomes. And studies have shown that, for example, if a person doesn't have a family doctor and they end up going to the emergency room, it costs 5 to 10 times more to taxpayers. And people have poor survival rates without family doctors. And I put in lots of studies in the op-ed in the Gazette, so I encourage people to read it. And I think we could, and people live shorter time. That when you have that, you live several years less than the person who has a family doctor. And whenever they've increased the number of doctors, people live longer and do better. And we have approximately in Canada, there's about 20,000 shortage of family doctors expected over the next 6 years, which is about 3,300 physicians per year. And I went through looking at the number of medical schools we have and how we could fix this problem with the number of doctors we actually have and how can we solve it in the next few years. We're not talking 10, 20 years, but in the next few years, in the short term and in the long term.
You also point out, and this is really quite striking, you say, you talk about the doctors we're going to lose, but you suggest if we just added, this is per doctor, right, per family physician, one additional patient a week, what would happen?
Yeah, we would solve this problem in a few years. It doesn't take long. I have committed to that myself. I probably do a little over 200, up some years 300 new patients a year, which is a bit hard. I'll take a whole day and I'll just see new patients. And during the summer, I will take time off where vacation time. When I say, listen, I'm going to try to see these people who are on my waiting list. I don't have a government waiting list because I'm a solo practitioner, so I have people's families who call or would you take care of. And I just feel badly. I mean, do I need the extra work? I mean, I get paid for it, obviously, but I could still see the same patients, maybe my own patients more often and get with the same income.
But by the way, relating to this, though, that one extra patient per week, you're right that would pretty much, at the end of it all, reduce waiting lists by almost 3 million patients per year. I mean, that's a staggering number for just taking one extra patient for every family doctor.
Yeah, and I think if we could do that, and then we have to look at long-term. Also, there's a shortage of family doctors, and we have very smart students graduating from schools and they can't get into medical school.
Yeah.
And I don't think you have to have a 97 or 98%. I mean, if somebody has a good average, I'd say 85 and over, and has a good heart and wants to take care of people, we should, and they want to do medicine and they want to do it for the right reasons. I think we should train and educate. We can do it. We don't have to necessarily go and get foreign trained doctors, taking them away from the countries where they should be and they need help, and then having to put them through a whole program of training here, which also takes time. So I even suggested that we increase each medical school increases the number of people who would be admitted to the medical school. About 200 students a year of our 17 accredited medical schools. Quebec has already started, by the way, and I'm very happy. I wrote an article actually a little time before that recommending that they do that, and I don't know if that's related to what I wrote or just lots of people thinking about it and writing about it. So we can go even more and better. And then also I suggested for doctors who are at retirement or thinking of retirement, because we lost, as you know, lots of doctors during COVID. They just, I don't think got scared and they figured maybe this is the time to hang my hat. But we can incentivize doctors by, let's say, giving them tax breaks, tax credits. And then we'll need teachers also for people who are going to medical school, and I suggested that we also incentivize them and encourage them to teach, especially those thinking of retiring rather than just retiring, to give back. I am very thankful. I graduated from McGill. I was born and raised in Montreal. I did spend some time in the States where I also did post-medical training and work. But I consider myself really blessed having graduated from McGill, being able to work here and give back, and is just there are miracles that happen in our healthcare system. My daughter was a survivor because of great cardiac care she got when she was little. She's 15 now, and I just say that we have so much to be thankful for, and we need to make sure everybody has a fair chance at getting the best health care, and we can offer that. And I often go back to the Good Samaritan model, which is in a law here in Quebec. People often don't know where that story comes from, so I remind them it comes from the Bible. Even if people don't consider Jesus as God, he was considered by I think the Muslims as a prophet, by the Jewish people as a rabbi, and by many people as a great example of caring, because he would go around to heal people. But he gave the story of the Good Samaritan, of a guy who found the person left half dead on the side of the road, and he stopped and picked him up, did first aid with oil and wine that they used back those days, took him to an inn, and told the innkeeper, "Here is the money, take care of him, and whatever more you need, I will give when I come back." And we never know the outcome of that poor fellow was left half dead. Did he survive or did? But it didn't matter. It was that we take care of people, and I think that should be our model. And we just can't give up. And regardless of the economy, regardless of world events, this is something and I really believe when we do the right thing, we'll all bless as a society. We'll all do better.
Dr. Saba, I have to leave it at that. I do hope we're going to start to hear some discussion on healthcare and how we can fix a system that clearly needs to be fixed between now and the end of this campaign. I thank you so much for your time.
Thank you, Aaron.